We're talking about health disparities with congenital heart disease with Dr. Santiago Borasino, Medical Director of the Cardiovascular Intensive Care Unit here at Children's of Alabama. Dr. Borasino, thanks so much for your time.
Thank you for inviting me.
So let's talk first about congenital heart disease and what it is specifically. What does it mean when a child has congenital heart disease?
Congenital heart disease arises from problems in the development of the heart in utero. That means when the baby is inside of the mom. Usually happens before 8 weeks when the heart is completely formed. And most of the time is like connections between the different chambers of the heart or abnormalities on the large vessels that come out of the heart that then cause problems when the baby is born, or sometimes can go unnoticed for life. Not all of them are life-threatening.
How common is it in the general population?
It actually happens up to 1% of the live births in the United States, so about 40,000 a year.
Wow.
But only 1 in 4 are what we call critical congenital heart disease, which means that they need surgery in the first year of life.
What about among minorities? How common is it among minorities?
As far as we know, there is no difference in how often it happens between different groups. So it's about the same.
So and we're talking about health disparities. It's a very common topic in the world of medicine, of course. What are some of the factors affecting minority health disparities as it relates to congenital heart disease?
The biggest one probably is access to healthcare.
Yeah.
The outcome of the severe critical, the most critical congenital heart disease is the one that presents in the first two weeks of life. And for that, being diagnosed before the baby is born, so that the baby can be born in a center close to a center like ours. For example, here at Children's of Alabama, we have University of Alabama Birmingham's Women's and Infant Center, so they can be born there and then come to us immediately upon diagnosis. So that allows us to sort of treat the patient knowing what they have from the get-go without letting them get too sick, compared to patients who are born not knowing that they have this. And they can actually look pretty normal for the first few hours of life, and then all of a sudden they crash and they get extremely sick. And then we have to transport them from their hospital to us, and all of that delay just creates complications and just makes it a little bit harder to prepare the patient for a surgery in the first few days of life. So the mom having good access to healthcare, having good access to doctors, OB doctors, would allow for a higher percentage of the patients with severe critical congenital heart disease to be diagnosed early. And unfortunately, there are disparities in access to health for minorities in our country still, access to good health insurance, good coverage, and problems like transportation. Mom needs to make it to the doctor, and things like that end up affecting, or there is no doctors in certain areas, rural areas of our state. It's not that easy to get to a doctor. So all those kind of things can affect the outcome of congenital heart disease.
Is there anything that can be done to address those issues, to improve those outcomes?
Obviously, from our standpoint, we try to do education to other hospitals. We try to expand our ability to diagnose patients before they're born. When they're here at Children's of Alabama, we make all the efforts to help them with transportation, with logistics. We have social workers, case workers. We make all the effort to try to make sure that every single family gets every opportunity for a good outcome.
And regardless of what a patient's situation is, obviously here at Children's of Alabama, we have great resources, and you and the other medical professionals are going to do everything you can to help every patient the best that you can.
Yes, once you're here, everybody is precious, everybody's a priority, and it doesn't matter. We are going to take care of our patients are our family, and we're going to take care of them all the same.
All right, once again, Dr. Santiago Borasino, Medical Director of the Cardiovascular Intensive Care Unit here at Children's of Alabama. For more information, go to childrensal.org.